Thank you, chairpersons, and thank you, Team Gujarat, for giving me this opportunity. I must thank Pratap Bhai for giving this particular topic to me. So I have spoken on early onset diabetes earlier in Ahmedabad during Diabetes India, and then at IDF. So I was relaxed about the topic, but then I read the question that is asked: is it really dangerous? So for answering that question, I had to do some literature review, and in that I learned so many things. So the content was so much that I will restrict my presentation only to is it really dangerous. I won't have time for discussing the epidemiology of young onset type 2, the causes, the prevention, the treatment, and so on. These are my disclaimers. There is no financial disclosure, and these are not AI generated slides. I might have used ChatGPT for getting the correct articles, and Napkin is a tool that I use for creating some visuals. Other than that, nothing is AI generated. So I'll start my presentation with this slide, which is of the age distribution curve of type 2 diabetes, published in 2008-9 from Canada. What you can see here is that the peak is at 75 to 79 years. So the prevalence of type 2 diabetes was more common in the elderly population at that time. There is another published study from Swedish registry, and here the peak has shifted to somewhere around 67 years. This was published in 2012. And then we have the latest one from our ICMR INDIAB, published by Dr. Mohan's group just 2 years back. And now the peak here in Indian population is between 55 to 64 years. And the number of people with diabetes at a younger age group are increasing. It was not like this earlier, and the shape is changing. This is the unpublished data from Defeat Diabetes campaign that we did a few years back. Many of you were participants in that particular campaign, and this is the age distribution curve of data that we collected during Defeat Diabetes campaign. Here the peak is again at 45 to 59. This is the distribution, and you are having individuals with type 2 diabetes even at the age of 18 to 24. These are males and females. From these three slides, this slide anyway just shows that in the ICMR INDIAB, Dr. Mohan said that the takeoff point for development of type 2 diabetes is at 25 to 35 years in Indians. So the prevalence suddenly rises from this age, but in Defeat Diabetes, when we analyzed the data, there was no takeoff point. Starting from the age of 18, we had a steep rise in prevalence of diabetes in our population. Oh, sorry. Neelam, these are not updated slides actually. I updated the slides. Dusri slides anyways. So now I'll come back to the slide. This is from UKPDS follow-up study, which was published a few years back, and you all must be aware of this study. It has shown that the intensive treatment of diabetes by giving metformin or sulfonylurea or insulin, it gives significant benefits in terms of reduction of the cardiovascular risk and microvascular complications. I'll just focus on this particular part of that, just to give some analogy here, nothing to go in depth of the particular study. So someone who develops diabetes after a duration of 5 years, if he is intensively treated, the risk of developing complications is reduced. That we all know, not from Wikipedia, but from all the other studies also. Does the duration of diabetes also play a role? So if the same person who was intensively treated, if you look the person after 10 years, his risk is equal to a person who is not intensively controlled but having duration of only 5 years. The point that I'm trying to make here is the duration of diabetes also matters. If you develop diabetes 5 years earlier, you will lose all the benefits that you get by intensive control. The same can be seen here also. So someone who is having this risk by intensively treating and this risk by conventionally treating, after 5 years, the person who has been intensively treated also will be having the equivalent risk of a person who is not intensively treated but 5 years lesser duration of diabetes. So the HbA1c control as well as duration of diabetes is important, and people who develop diabetes at a younger age, like we are seeing now 10, 20 years younger, they are having a very high risk of developing complications which may not be addressed by just controlling their glycemic burden. Now, when I did this search, there were several studies. These are the landmark studies which are particularly looking for type 2 diabetes in young population. The definition of young might vary. Earlier it was 40 years, then 35 years, 30 years, now even 20 years. There was a slide which is missing here. CDC is now doing a study the Center for Disease Control, where they are looking for diabetes type 2 in people younger than 20 years. And as per their calculations, if the incidence remains same, after next 35 years, the numbers will increase by 700%, which means 7 times. Anyway, these are the landmark studies. I'll talk about these studies in brief now. These are all for young onset type 2 diabetes. Today's study group has published several publications. They did a study between 2004 to 2011. There was observational follow-up from 11 to 20. It was in 2 phases, phase 1 and phase 2. And they looked at the complications of type 2 diabetes in young diabetics specifically. They published several papers. I'll just talk about one of those. This is the HbA1c. So at the onset, 75% people have a HbA1c of less than 6.5. Very few are having between 6.5 to 8. After 3 years, the number of people with HbA1c under 6.5 goes down drastically. By the 6 years of duration of diabetes, only 28% remain controlled, and you see 40% people having HbA1c of more than 10%. So the glycemic control worsens very fast in individuals who are developing diabetes at a younger age, and it translates to the risk of complications. This is the hypertension, CKD, dyslipidemia, neuropathy, and overall risk of any microvascular disease. After a duration of 9 years, in young onset type 2 diabetes, 50% of them develop some or other microvascular disease, and after a duration of 15 years, 90% of them would develop some or other microvascular disease. So imagine somebody developing type 2 diabetes at the age of 25, despite treatment, by the time he becomes 40 years, he already has some or other microvascular disease. And these are the first disease, second disease, third disease. On average, by 9 years of diabetes, they develop 3 microvascular complications. This is another study, START study, the study of the newly diagnosed early onset diabetes. There are 400 patients included in the study, less than 40 years onset of diabetes, and they did a cluster classification. So they classified these people based on SIDD, MODD, and so on, and they looked at their carotid ultrasounds and echocardiography. These are all young onset diabetics, and at the time of diagnosis of diabetes, they have this much of abnormalities: carotid artery abnormalities, intima media thickening, plaque formation, echocardiac abnormalities, left atrial enlargement, abnormal left ventricular geometry. So around 40% of people with SIRD, they already have a carotid artery abnormality at the baseline itself in the young population. What about the cardiovascular disease and mortality? This paper is published from Swedish National Registry. Here they have a registry from 1998 to 2012. 300,000 patients are included, and they have a control of 1.6 million. And then they did a outcome analysis in the year 2014. Median follow-up was 5.63 years. Here they compared the risk of complications in different age groups. Someone who develops diabetes at less than 40 years has more than 2 times increased risk of mortality, all-cause mortality, CV mortality, CV events, CHD, I can't read it clearly here, but heart failure, AF, and so on. So the risk of all these complications increases by 3 to 4 fold just because you develop diabetes at age less than 40 years. This is an interesting slide. So these are the normal people, controls. They are not diabetic, these are diabetics. So someone who develops diabetes at the age of 71 to 80, his expected survival is equal to the person who is not having diabetes. But if they develop at a younger age, this is the difference in the survival. The survival goes down drastically. So a person developing diabetes at a younger age has got a number of years which are lost. Around 10 years of life are lost, the survival goes down. This is a study from Enhanced data, which was collected from 1999 to 2018, 8,000 participants. And then again, they looked at the association between age at diagnosis and CV and all-cause mortality. They divided into 3 groups: less than 40, 40 to 59, more than 60. And they had a total follow-up of 67,000 person per year. And this is the analysis. We will not go into model 1 and 2 and 3, but compared to individuals who develop diabetes at more than 60 years, someone who develops at less than 40 years has 2.26, 2.28, 2.58 times higher all-cause mortality. Similarly, 2.5 to 2.8 times higher cardiovascular mortality. And these are age standardized. Then this is from UKPDS. UKPDS is the landmark study which we all have studied, and now UKPDS, they have a follow-up of more than 30 years. So they did a sub-analysis of individuals who had young onset diabetes when UKPDS started, 1977. That time there were fewer patients of that age group. but still they had 429 people who were diabetic, age of onset less than 40 years, out of total 4,500, and now they have follow-up of 17.5 years, a long duration follow-up of these people. And here they have plotted again any diabetes-related endpoint, all-cause mortality, diabetes-related mortality, major cardiovascular events, MI, microvascular disease, PAD, stroke, all these are the charts based on the age groups. So the people who develop younger onset diabetes, they have a higher risk and they develop the risk earlier. And they also looked at standardized mortality rate. So from the same Wikipedia study, sorry, again, one slide is missing here. So compared to people who are developing diabetes at an elder age or more than 65 years, someone who develops at 25 to 35 years has a 3.85 times more risk of mortality. Then 36 to 45, it's 2.46. Younger you are, the higher is the risk of mortality. This is JADE program, particularly from Asia. It started in Hong Kong, and it is not only for young diabetics, but they started making a registry of individuals from 1995. In 2007, they had a web-based disease management program. 2009, they converted into RAMP, and basically it's for managing type 2 patients, and they have shown by giving a holistic care to patients, you can reduce the risk of complications by 30 to 60%. From this particular program, they have a paper which is looking at particularly only young diabetics, type 2, and in Asian population. So that paper I am showing you here. This is a paper published about young onset type 2 diabetes, Asian people. And what they found is, here they have around 9,000 people from India also. The duration of diabetes is longer, obviously. Fewer patients achieve the A1C concentration of less than 7%, higher mean concentrations of HbA1c, higher LDL, higher prevalence of retinopathy, and they are less likely to receive statins or ACE inhibitors or ARBs. Poorly managed. Now, is it only in type 2? Is it in type 1 also? Is there a difference? So this search study answers that question. So they looked at the individuals who are developing diabetes at younger than 20 years, type 1 and type 2, and then they compared their outcomes. They had a follow-up from baseline to 12 months, 24 months, and 60 months. And this compared at the same age, if you are getting type 1 diabetes or type 2 diabetes, what is the risk of complications? So these are the outcomes here. Type 2, type 1. DKD 19.9, 5.8. Retinopathy 9.1, 5.6. Peripheral neuropathy 17.7, 8.5. Cardiovascular autonomic neuropathy, there is not much difference, 15 and 14. Arterial stiffness 47, 11. Hypertension 21, 10. So at the same age, someone who is having type 1 diabetes or type 2 diabetes, a type 2 patient has got multifold risk of all these complications except the cardiac autonomic neuropathy. Now this is a meta-analysis of multiple studies where they looked at only studies which are in type 2 young onset, and they had around 26 studies to be included, and again they had some very interesting findings from this study. If you delay the development of diabetes by just 1 year, you can reduce the risk of all-cause mortality by 4%, macrovascular disease by 3%, and microvascular disease by 5%. This is just by delaying the development of diabetes by 1 year. And if you look at all these components individually, by delaying the development of diabetes by 1 year, these are all the benefits that you get: CHD, CVD, peripheral vascular disease, retinopathy, nephropathy, and neuropathy. And all these benefits you may not be able to get by a good glycemic control also. Just by delaying by 1 year, you can get all these benefits. So with all these studies that we have gone through, the important message here is that if you develop diabetes at a younger age, even if you control it very tightly, you may not get much benefit because you are having to live the life with diabetes for a prolonged duration. The duration of diabetes also counts. What can be done is to either prevent development of diabetes or delay it by at least 1, 2, 3, 4 years, and there are benefits which are seen. So prevention of diabetes, delaying its onset, is the thing that we should look for, and in that direction we had published this Ahmedabad declaration, which was presented in Diabetes India in Ahmedabad recently, and here we talk about the different causes. One of the important causes which is responsible for increasing prevalence of type 2 diabetes in youngsters is the maternal health. So because the diabetes in young individuals is increasing, the younger females, they are also getting diabetes. The age of marriage is increasing. So now a girl gets married at 28, 29. By that time, she might either have some prediabetes or hyperglycemia. Hyperglycemia during pregnancy has some epigenetic changes on the baby in the in her uterus. which leads to the risk of getting insulin resistance and obesity in the baby, further developing diabetes, and that chain is continuing. So in this particular paper, we highlighted on the importance of taking care of our female children from very young age. So from the young age of 7, 8 years, we should look for prevention of obesity. She should not become obese, PCOD, and she should not develop the hyperglycemia during pregnancy, so that we can prevent all this. We can bring the generational change and we can have better generations. So the takeaways from this presentation are that the prevalence of young onset diabetes is steadily rising, as we saw from the previous 3-4 slides. And the benefits, this is not a study to quote here, but what I could show you visually from that particular graph is that if you are getting diabetes at a 5 years younger age, if you are having 5 years more duration, you will lose the benefits of intensive glycemic control. Young onset diabetes is associated with increased risk of micro and macrovascular complications. Several studies we have looked for that. And young onset diabetes is also associated with a higher mortality. There are studies to suggest that also. The last study, the meta-analysis that we discussed, was very important. With every 1 year delay in the development of diabetes, you can see significant reductions in the complications as well as mortality. And that is why prevention is the key. If you can't prevent development of diabetes in youngsters, at least try to delay it by a few years. Thank you so much.